Bob and Brad, the two most famous physical therapists on the internet.
Well, hi there, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you how to perform nerve flossing for a pinched nerve in your neck. So that could be the median, ulnar, or radial nerve. So we had a video where we talked about this, Brad.
Sure.
Whether, flossing, basically you're trying to get the nerve to glide better.
Right.
And it might not be gliding well now because it might be some scar tissue
Sure.
holding it down, or maybe the hole where it comes out of is narrowed up. And
keep in mind, if you're not familiar with this flossing in the nerve, so the nerves come out from the lower neck and they come down. There's three of them that we're going to talk about, down all the way into the arm, into the hand, and past the wrist and into the hand. So we need to get those nerves moving as they're supposed to be, as opposed to sometimes they get locked in or scarred in.
yeah, so the idea is you're getting pain all the way into the arm. That's why you're doing this. Now, I don't know about you, Brad, but I tend to do this as somewhat of a treatment of last resort.
Yeah,
I try other treatments first.
I agree.
And because the reason behind that is this can help greatly, but it can also make it worse. And so we're going to talk about that today, what you got to watch out for.
Right.
So first we want you to check with a healthcare provider to see if the flossing is correct for you. And you're going to need to know which nerve to floss anyway.
Right.
You don't floss all three. You just floss the one that's
Right.
giving you trouble.
And we'll show you the different techniques.
Yeah. So if you're getting pain, numbness, and tingling, let's say, for example, the ulnar nerve, you're going to feel that in the pinky and half of the ring finger.
Right.
That's the sensation. You're going to go, oh, there's pain here. There's
Right,
a weird sensation here.
Yeah, it could go numb, actually.
Right. Or weak.
Yep.
So we'll show you how to floss that one. But you figure out which nerve you're going to do. Let's start off with the precautions, Brad.
Sure.
We want you to be very careful. First off, if you're doing this, you're going to do it 10 times the first day. If there's any pain, you stop immediately.
Right. If it makes it worse.
Yep, you stop.
Yep.
And you could try it again maybe in another week
Yep.
if it hurts. If it doesn't hurt, just do it 10 times that day, and then you can repeat it the next day and try it again and see if you can do it without pain.
And with any luck, the next day, your overall pain level should be dropping a little bit, so you want to continue to stretch it, but not too aggressively.
Yeah, it can take a while on this. This is not always a one day gets better. It might be 3 weeks before it starts getting better,
Sure.
the way the gliding works. All right, let's talk about the median nerve first, Brad. So the median nerve, it's actually the nerve that is involved with carpal tunnel.
Right, the same one goes through the carpal tunnel.
Yeah, we
That's why
actually
call
have
it that.
people do this gliding with carpal tunnel
Right.
syndrome too.
It's a-
So you're going to have pain or tingling or numbness in a lot of the thumb, the pointer finger, the middle finger, and half the ring finger.
Right.
I got it right this time, Brad.
It's kind of interesting how it's half, but it is. You have patients say,
Yeah, this side.
it's numb on this side, but over here it feels normal, and that's normal.
So you can do this seated or standing. I'll do it seated right now, Brad. So
Sure.
I'm going to bring an arm out. Okay.
It's a long arm.
Yeah, a long arm out, and you're actually going to, so this is my painful side. You can actually bring it back just a little bit.
So this way.
That way, yep. And my palm is pointed towards the ceiling. And what you're going to do, you're going to bring the palm down. And while you bring the palm down, you tilt your head at the same time. That's flossing the nerve. If I went this way, I'm stretching the nerve.
Yeah. Ooh.
So this is allowing it to floss forward. Now, what you'll generally find, if you compare the two sides, like you might have much better motion on this side.
Sure.
This one, you might only maybe let you go a little ways.
And you'll know if you're stretching that nerve because you're going to feel that painful sensation throughout your arm and up in your neck. It's usually not like a muscle stretch pain.
Right.
So
if you can't go as far, don't push it and cause pain.
Okay.
Just bump into the pain. It hurts a little bit, but that's okay.
So I always imagine if there's like a string from your fingers to your head, when the fingers go down, it pulls your head with it.
There you go. Good one, Brad.
And so that gives a visual cue for some people, and that makes it easier. Because it can be a coordination thing. It's
Right.
like doing this and whatever that
Yeah,
thing is. Yeah.
patting the head and
Yeah.
circling the stomach. All right, next one for the ulnar nerve. This one's kind of an interesting one. So this one, it's like you're making glasses.
Oh, yeah,
So
it's a fun one.
Yeah, I make a circle like this, and I actually grasp onto my jaw
With you,
and then go up
with
like
your
that.
fingers.
Yeah, with my fingers.
You get a little
Yeah.
finger hold there.
And that's stretching it. Now at the same time, you got to bend towards that side.
And if you're like I'm a little not flexible in my shoulder, and I have a hard time doing this one with my. There we go.
Yeah.
Yeah, remember this when you're a kid?
Yeah.
Oh, I could do it when I was a kid,
Now,
but not now.
the same thing with this, Brad. What you'll find is that you maybe only go this far, to start.
Sure.
You might only be able to go like this.
Yeah.
Make sure you're tilting the head again on this one.
I'm
So
going to do the left side because I know
one, yeah,
you
me
might be
too.
touching the mic.
One, I'm two, and then maybe go up a little higher. Three. I'm not that great on this side either, Brad.
My left side is my
left
whole
side's
left shoulder is tighter too, but it's getting better. It'll be good for other range of motion too.
So same thing with that. Again, be very careful, but don't increase the pain by all means.
Right. If you get that weird, unusual, that nerve pain, and it's like uncomfortable, just stop.
So the radial nerve, the last nerve, is actually half the thumb on the outside here. In the back, it's actually the full thumb.
Mm-hmm.
And then it catches the tops here of some of these fingers.
Sure.
Now, the radial nerve, I think I'll do this one standing. Mike, you okay if I stand up? All right, so I'm going to put my arm at my side with the palm twisted out like this. It's like you're looking for a waiter's tip, they call it. Like you're trying to get a tip.
Oh,
for
like,
somebody.
the
Yeah.
get it from
Right,
the
right.
sneaky tip.
So the palm's faced out. And now you're going to flip the palm up to the ceiling. And while you're flipping it up to the ceiling, you're bending your neck towards the side again. So I'm going like this. Again.
Oh, so we're going, the palm goes up and the head goes
towards
the
it. It's
palm.
up, right.
So this is just the opposite of the median nerve.
Right. Yep, exactly.
So your fingers are coming up, you're going to bring your ear or your side of your head towards your fingers.
Yep. And again, you'll probably be on the painful side. You won't have as good emotion as you do on the non-painful side.
It is really helpful to compare one side, the involved, to the
I would
uninvolved.
try with all these. I would try the non-painful side first, so you know what you're doing.
Oh, I thought you meant give yourself a hand.
Yeah, give yourself a hand.
No, I agree. That's one nice thing about working arms and legs. You can compare one side to the other.
So I want to see if I can get Brad to open his wallet up.
I don't have my wallet, Bob. You think I'm silly? I don't bring my wallet to work.
By the way, this video is part of a series of videos on neck pain.
Yeah.
If you go to bobbrad.com, go to the neck pain section, and you'll find 20, 30 videos on neck pain. Watch the ones that pertain to you. They're all very helpful.
You just scroll right down the videos, look at the title. If the title pertains to your problem, you got about a 10-minute video. There's also a PDF where you can click on that, and it'll print out on paper a review and exercises of the video. You can keep that. It's all a wonderful, in-tight package for your convenience. It's free. We do not even ask for your email.
Yeah, so you just need to look for the ones that catch your fancy.
There you go.
That's the way we want.
If you want to watch all of them, you can.
Yeah.
But pick out the ones that work for you, that you need.
Tickle your
Tickle,
fancy?
yeah.
I think catch your fancy too. I think they're both appropriate.
Well, Mike's younger. He doesn't
Yeah.
understand those things.
All right. We'll check out here.